I call Jami-Lee Ross.
I move that the question be now put.
Sue Moroney.
Thank you, Mr Chair. And I really do thank you for giving me this call, because in my first debate on this part 6, I was about to put a question to the Minister that I really would like an answer on. And I raised a similar question around a different clause that had the same effect in part 5, but the responsible minister wasn't in the chair at the moment, and I really do feel at the time. And I really do feel that if he had been, I feel that he would have given us an answer, because it is a serious discussion that the Select Committee had in quite a lot of detail around the injury prevention programs that are jointly undertaken by WorkSafe and funded by the corporation, or jointly undertaken. And so I'm referring now to clause 249 of part 6, which amends the ACC Act. And I was kind of in mid-flight of asking the Minister this question when my last call finished, so I really appreciate the opportunity to put this question to the Minister directly. Because where the Select Committee came to was that we were, I guess, so concerned to make our views known about this that we included it in the commentary, because we've got some advice from the officials about what it would mean. And the reason for that is that I had raised a concern that where currently ACC injury prevention programs do have a requirement on them to reduce the overall impact of ACC levies on the work account, and that is, well, some would say is right and proper for ACC. I've got a question mark in my mind over that. What this bill does, I was concerned about. I was concerned that what this bill does is actually apply that same thinking to WorkSafe injury prevention programs. And why should I be worried about that? Well, actually, sometimes a good workplace injury prevention program will actually increase the impact on the work account of ACC levies. How does it do this? Well, in 2 instances in the main. The first is the perverse and strange impact on the ACC work account levy, that the fact that for some injuries they are so expensive that if we are paying to support that person with their injury for the rest of their life, that can be more expensive than if the injury that they had incurred had killed them at their workplace. And as harsh as that is to discuss in the debating chamber, it's just a reality that sometimes if someone dies in the workplace, which is what we're trying to prevent, that is less expensive for the work account of ACC than if they were seriously injured, which, you know, if they are injured and when they're a young person, that could have a lifetime effect on the work account of the ACC levies that is much larger than the payment that would be made, in fact, to their family if they had died. And so we don't want that. We don't want that perverse incentive. We want to make sure that these workplace incentive programs they are saving people from dying. And they are bringing down that dreadful workplace fatality record that we have here in New Zealand, and that we are seeing that the deaths in agriculture that we know have totalled 104 over the last 5 years, that is reduced. And so we don't want a workplace workplace injury prevention program that somehow doesn't pass muster, because it can't necessarily prove that it's going to actually lead to a reduction in the impact of the levy rates in the work account. So that's example 1. Example 2 is with regard to occupational disease. So these are things that people, they may not even know about at the time. And a good workplace injury prevention measure might actually increase the education, should actually increase people's knowledge and education about occupational disease and the impacts on that. It might lead to, therefore, more claims being made against the ACC levy work account, because people understand that the symptoms that they're displaying some years down the track from the exposure, it might have been a chemical exposure, it might have been an exposure to asbestos, it may have been the many kind of hidden things in our workplaces that can cause people occupational disease, and that's often a long way down the track.
The Honourable Damien O'Connor.